It is the perfect song to play, Unhealthy, because I think we tend to forget that our kidneys are a vital part of our health. We certainly needed reminding. And yesterday, we caught up with Rian, Gale and Tracey Saweirs from the Chronic Kidney Disease team, Northland DHB. And we asked Rian, first of all, what do our kidneys do?
So our kidneys do lots of jobs, but basically, in a nutshell, they make urine, remove waste from our bodies, so they clean our blood continuously all day. They keep your blood pressure in a healthy range, so look after your heart. So they make red blood cells and keep your bones strong.
People don't realise how important the kidneys are. Everybody knows that they make urine, but they don't realise all the other things that they do. And that's why it's so important that we look after them, because they are actually so vital for your health.
So, Tracey, how do we keep our kidneys healthy?
It's, like drinking water instead of lots of sugary drinks, cutting down on refined sugars, like cakes and lollies and biscuits. I'm not saying you can't ever have them, but just, everything in moderation, eating lots of fruit and veg. And an important factor as well is cutting it down on the amount of salt that you have in your diet. We all have too much salt. And so even just stopping adding salt to your food would go a long way in helping your kidneys.
So how can we know whether our kidneys are in a healthy state or not?
There's a very simple kidney health check, we're calling it. So there's 3 tests that you need. One is a urine test, so looking for tiny protein in your urine. So it's not like if you have a urine infection test, it's the one that goes to the lab, so it's a little bit different. You have blood pressure, so we do your blood pressure check and also do a small blood test to check for the rate of which the kidneys are filtering.
Who should get a kidney health check?
Well, definitely anybody with diabetes or high blood pressure, but also people who are over the age of 40 who are Maori or Pacific Island or Indian, and any Pākehā over the age of 50. So, that's a lot of people.
Yeah.
And if they've got a family history of kidney disease, then it's a good idea to get a health check as well. One of the other things about looking after your kidneys is you're actually looking after your heart at the same time, because it's actually the same things of looking after your heart as looking after your kidneys. So really it's a total looking after your body completely.
Yeah.
Now, tell us about this new project that's going to be going across Te Tai Tokerau, aiming at improving kidney health.
So we started the early chronic kidney disease project back last year. We're going around all of the GPs across Northland, so it's a regional project. There's just 2 of us working. We're visiting GPs, practice nurses, pharmacists in the community, and we are promoting our messages of kidney health and how to get a kidney health check.
Can we get a kidney health check at our GP?
Absolutely.
It's not urgent that you have to rush into your GP today, but The next time you have an appointment with your doctor, and you fit in one of those categories that we talked about earlier, then it's a good idea just to say, look, if I had this kidney health check done, because the one part of the test that's not done is the urine test. Most people will have had the blood test or the blood pressure.
Okay.
But a lot of people won't have had that urine test done, and so they need to have that done as well. Kidneys rock. We need to look after them.
Absolutely loved having you 2 on the show. Have a great day and keep up the good work in keeping our kidneys healthy here in Northland.
Thank you.
It was Rian and Tracey from the Chronic Kidney Disease team.
A few things to think about there, right?
Yeah, fascinating. That link between the kidneys and the heart.
Yeah.
I mean, we think about our liver a lot, don't we? And you hear, that your liver is suffering, but kidneys are just as, if not more important.
It's the old sugar and salt thing that comes through every time, doesn't it?
I would love
Sigh.
every health message to be delivered in a Scottish accent, I think. I think just helps it sink in a lot more as well. That was beautiful.
Thank you, Rian and Tracey. Really lovely to catch up.